So, what is it? So, some people who have been affected with the virus that causes COVID-19 can experience long-term effects from their infection, known as post-COVID conditions, PCC, or long COVID. Post-COVID conditions are a wide range of new, returning, or ongoing health problems that people experience after being infected with the virus that causes COVID-19. Join our panel discussion today to learn more about post-COVID conditions, risk factors, and how we can best support our loved ones. So these are our three speakers for this afternoon. They have a variety of experience with students and patients. Our first presenter is Dr. Rossi Hassad. His professional expertise includes epidemiology, statistics, education, research methods, and mental health. His study also includes a teaching and research emphasis on statistical literacy and evidence-based practice in health and behavioral sciences. He also provides media commentary on infectious diseases, including COVID-19. All right, Professor Rossi, you have the floor.
Well, thank you, Christina, and welcome all. I'm happy to join the panel or the panelists here today, and I commend the Office of Accessibility for spotlighting this issue because the evidence is rapidly emerging that this is projected to be a major health concern. So thank you again. So with that introduction that you gave, let me add to that. May I have the first slide? Is this the first slide for me? Okay.
Yes, this is the first slide.
Okay, I thought there was another slide. Okay, so when we talk about long COVID, the jury is pretty much out that if you have had COVID and if you've had it multiple times, chances are you are in it for the long haul. That does not mean there's nothing you can do to reduce the likelihood of severe outcomes in the future or to improve your quality of life. Whatever you call it depends on who you ask. There are two major bodies that provide expressions for these various health conditions: the Centers for Disease Control in the United States and worldwide, the World Health Organization. But long COVID, whatever you call it, it has that component of an extended period of symptoms following your recovery from COVID. That long period that we talk about can be weeks, can be months, and there are those people who have had these symptoms for as long as we have had COVID, and we are approaching 3 years. Common names that you will hear are long haul COVID, long COVID, post-acute, meaning after the active infection, post-acute sequelae, meaning having complications following COVID, or simply put, long-term COVID, or chronic, which means over a protracted period of time. So I think the emphasis is on a continuation of symptoms or the after effects of COVID for a lengthy period. Why is this important? Well, current statistics show that 1 in 5 adult survivors of the illness, regardless of the severity of your illness, meaning whether you had a mild episode, a moderate, or a severe, you are at risk of developing long COVID. You will see later that long COVID means different things to all of us. It depends on the body, organ, or system that is being attacked or involved. Thank you. Next slide. So, of course, when we talk about developing a condition, everyone does not develop that condition. So not everyone who has had COVID will develop long COVID. So it's important to know what puts you at risk. Now, this is still evolving. The research on long COVID itself, I would say, is approaching the 2-year mark. And what we know is that female sexes and female gender is emerging as a risk factor for long COVID, especially 8 to 9 months after an infection. That's an important point. Now, is this a biological predisposition, or is it a social determinant of one's health? Is it because of the situation that females find themselves in that may be putting them at greater risk, or not fully involved in seeking health care? Or is it a biological factor, such as one hypothesis talks about changes, hormonal changes, neurotransmitters, and so forth. So those hypotheses are out there. They seem plausible, and they are being looked at. Older age is a big factor. We saw this with COVID itself. Older age is usually a marker for your health status and how compromised your immune system is. Also, with older age comes some other conditions that can worsen not only COVID itself, but long COVID. And we are talking about conditions such as diabetes, hypertension, obesity, cancer, and generalized immune compromise, being immunocompromised. Of course, the severity of your COVID infection, whether it was mild, moderate, or severe, you are at risk regardless of the severity. But those who had severe outcome or severe COVID are at higher risk of manifesting or showing long COVID symptoms. Associated with that is your immune response to the infection. And implied here is the status of your immune system at that point, as well as your vaccination status, whether you were adequately vaccinated and boosted, which is what the other point talks about. And I've already mentioned pre-existing health conditions, which can be associated with age, such as diabetes, lung problems, autoimmune disorders, and obesity. Next slide. So there is no single test that you can do to diagnose long COVID, because long COVID spans a wide array of symptoms. So it may present differently in different people. It depends on the body system that is, or organ that is involved. Nonetheless, there are some generalized symptoms that we have heard or documented people reporting, such as this generalized fatigue, malaise, or tiredness, to the extent that it interferes with your normal course of life. And symptoms that tend to get worse after physical exertion, which are noticeable, which is different from the past. So those are two prevalent symptoms reported, and following a workup, oftentimes it is found to be long COVID. Remember, those symptoms are also symptoms of other diseases. That is why in the differential diagnosis, it can be very broad, and you need a competent healthcare provider to make that diagnosis. But when it comes to specific symptoms, here is what we have noted. For example, the lungs and the heart. If those are the organs involved, you tend to have reports of difficulty breathing or shortness of breath, coughing, chest pain, fast breathing or pounding, also known as palpitations. If the digestive system is involved, the common symptoms reported have been diarrhea and stomach pain. The most predominant symptoms are neurological symptoms. And it's a broad range of symptoms. Difficulty thinking or concentrating, which earlier on in the pandemic, we referred to, and we continue to refer to, as brain fog, although now we have more scientific expressions for these, even diagnosis in terms of proper names of diseases. Headaches have been reported, sleep problems, dizziness when you stand up, that feeling of lightheadedness. Also, those psychosomatic symptoms that you get with depression and anxiety, those pins and needles, feelings that you tend to get in your arms and legs. And the change in smell and taste, which is not only post-COVID, but also a symptom of COVID itself. Other symptoms that have been noted are joint or muscle pain, rash, and emerging, the data are rapidly supporting that changes in menstrual cycles could be associated with COVID infection and therefore a post-COVID symptom. Next slide. So I mentioned neurological symptoms. And in this regard, an area of key concern is mental health. And this is, while it's a general concern, it is a particular concern for our college setting. And especially where there are, when there is a high number of stressors in someone's life. And what we are seeing are conditions ranging from cognitive efficiency to anxiety and depression. Now, cognitive efficiency is emerging. I attended a CDC presentation recently, and it was humbling to see the evidence that supports the decreased cognitive efficiency that we are seeing in post-COVID cases. And one in particular, which I'll talk about later, cognitive fluency. I talked earlier about giving these conditions proper names, and that's what I mean. So it's no longer brain fog, it's lack of cognitive efficiency or lack of cognitive fluency, because those are proper diagnostic terms. Now, there are two major studies that came out this year, and I've cited them both here because they are like the key sources supporting post-COVID or long COVID. And what the authors report that are some of the most pervasive symptoms, widespread symptoms that they have seen are neurological, cognitive, and psychiatric in nature. And they have documented conditions such as psychotic disorders, people who tend to have a separation from reality. They have noted cognitive deficit, instances of dementia, epilepsy, and seizures. And given the results that they have seen from brain scans, whether CAT scans or MRI, and the change in body tissue, it is expected that these problems can go on for a long period of time. We talked earlier about brain fog, and this is that sluggish thinking, which I said was widespread earlier on in the pandemic, but it continues and it's very prevalent in long haulers, in people with long COVID. Two conditions that are very prevalent in the reports are anxiety and depression. More specifically, we are also seeing anhedonia, which is a lack of ability to experience pleasure. And that's, of course, is associated with both anxiety and depression. Also associated with depression is insomnia and debilitating fatigue, short-term memory loss, a sense and state of confusion, problems with concentration and attention. So you can see why it's very important that we address these, especially in the college setting. Generalized distress has been noted. So people may come to you and say, they can't identify a specific symptom, but they say, I feel distressed, I feel upset, and it should not be discomfort. Next slide. So, as I said earlier, there is no single test to diagnose long COVID. Long COVID spans a broad array of symptoms, and it can present differently depending on which body system or organ is involved. And it's very important that you consult with a competent healthcare practitioner. Next slide. I talked about cognitive fluency, so let me say briefly, since there's really strong evidence to support that cognitive fluency is one of the areas that is most affected when it comes to mental health and neurological symptoms. The ability to efficiently generate and articulate thoughts. So you're looking at a picture or you're looking at a scene and you understand what it is, but it's so difficult to come up with vocabulary, even vocabulary that you previously were able to access. Now, it is different from aphasia, which is you can have difficulty in finding the words, but if you're given enough time, you do find the words. So in cognitive fluency, it is a lack. You just are unable to come up even with extended time. Next slide, thanks. So how can we prevent or address long COVID? Yes, it's frightening. It can affect our quality of life. It affects people differently, but there are things we can do to improve our quality of life and reduce the severity. And the CDC has guidelines on actual medical diagnosis and various tests and treatments that you can use. And then you can also have there's some self-help modules you can use to help with anxiety and depression. But whatever you do, you should, if you're having these symptoms, if you feel different, you should not seek to self-diagnose. You should not discount it. You should consult with a competent healthcare practitioner, because diagnosing long COVID can be complex because many of the symptoms mimic other common diseases. Thank you very much. And that's the end of my presentation.
Thank you, Dr. Rossi, for all that information. We enjoyed learning more about long haul COVID, not just from the physical side, but from the mental side as well. So thank you so much for all of that information. Next, we'll be hearing from Kathleen Kenny-Riley. She is an associate professor of nursing. She teaches in the Family Nurse Practitioner Program and the Master's in Nursing Education. She also practices as a pediatric nurse practitioner at Montefiore Hospital. She has over 25 years of teaching, nursing, and nurse practitioner experience. She also has several areas of ongoing research. So Kathleen, can you talk to us a little bit more about your experience in the field with patients and just some information that you know about long haul COVID?
Sure. I think I do want to open up for questions, but most of my experience has been, I worked in the emergency room during the initial stages of COVID. And actually, a lot of the people that have long COVID that we interact with are actual healthcare providers. There's many nurses and nurse practitioners and physicians that I work with that have actually experienced long-term COVID. Some have had to retire or go on disability. So it can be very overwhelming, but I think the healthcare system here in New York is really starting to catch up. There's a couple of specialty clinics that are investing in this and providing interdisciplinary care that goes from the mental to the physical. And I think it's something that we're going to get better and better at taking care of as we move forward. But I think it's just like any new condition or illness that we have to learn more about it and watch. And I think research, is really important. And I think as Dr. Hassad said, it's really important to get connected with a site, with providers that actually are comfortable and able to recognize the symptoms and manage the symptoms for you. and then we'll speak to Colleen Powers, and then I think the questions will be more helpful to guide what other questions people have.
Okay, thank you so much for that. Colleen, you're up. She is the Director of Health and Wellness at Mercy College. She's a family nurse practitioner as well, who's been on the forefront of COVID-19 and the process here at Mercy College. She's provided the college with an abundant amount of information and resources to support students both in and out of the classroom. So Colleen, the floor is yours. Can you share with us just a little bit more about your experience as well as some information on vaccines?
Sure, Christina, thank you for having me here today. So, we have been in this office here since the beginning of COVID, and we have been, treating and managing all the students and staff here at Mercy College. And we've come a long way from the days of having 40 students in a hotel isolating for 14 days with absolutely no resources for them as far as treatment or prevention, nothing. Their mental health was at stake. Dr. Rossi spoke to that. I mean, we've seen a lot here, and but we have come a long way. So I was just going to speak briefly, a little more specifically about some of the tools that are, being developed. It's still a work in progress, as was mentioned earlier. There's no definitive answers yet, but research is still ongoing, and hopefully they'll just, things will emerge as time goes on. So, but two of the bigger let me speak to this. I was going to speak about vaccines and the antivirals, because both of those have been found to be useful tools. They're starting to see emerging in helping long COVID. Early in 2021, when vaccines were first developed and started being, disseminated out to the public, people started seeing, people who were experiencing some of the symptoms of long COVID once they got their vaccine, started seeing some improvement in some of the symptoms. It really is not fully clear how the vaccines were helping with these symptoms. One thought was that the remnants of the virus can be found in the tissue, which will cause inflammation, and that the vaccines were helping to clear out this inflammation, clear out the virus, hence reducing the inflammation and helping to improve some of the symptoms. Another thought was that it is an autoimmune reaction somehow in in your system, and that the vaccine will also help clear that out. Scientists are looking at, they're looking at antibodies and T cells and seeing how all these things react and interact, and helping to understand how that can improve people's symptoms. So will getting the vaccine reduce your chances of, developing long COVID? Like we said, the jury is still out. Vaccines will reduce your chances of getting COVID, or if you are vaccinated and still develop COVID, it will prevent you from getting sicker or being hospitalized or worse. So for those reasons, we strongly encourage everyone to be vaccinated, and ultimately, hopefully, they will find some benefit for long COVID symptoms as time goes on. The other tool we have in our toolbox right now at this point is the antivirals, Paxlovid, which is the antiviral medication that has been shown to lower the likelihood of hospitalization and death in certain COVID patients, may also reduce the risk of symptoms of long COVID. And there's a new study out through the VA department that is currently looking at all this. Paxlovid is an antiviral. You might have heard of something called Tamiflu. If you have the flu vaccine, if you come down with the flu, you take this antiviral. It is not an antibiotic. It doesn't treat the disease. What it does is help reduce the symptoms and shorten the duration. So it makes things a lot easier as you go on with the disease. This study on Paxlovid found that more than 9,000 patients given this medication within the first 5 days of their infection had a 26% lower risk of developing some of the long COVID conditions. So that's good news, which included, as was mentioned earlier, the heart disease, the blood disorders, fatigue, brain fog. So this is all good news on the horizon. The mean age of these study participants was 65, which is also one of the higher risk groups of developing long COVID. And the majority of these patients were male. So hopefully, they've noted that the decreased symptoms of long COVID associated with Paxlovid exists regardless if the person, it was their first infection or it was a reinfection. And it also, helped them regardless of their vaccination status, whether they were vaccinated, boosted, or not. So that is some good evidence that they're starting to look at, and hopefully we will see some of these come to fruition as time goes on. And that's hopefully
your
that's
end.
it. That's my end.
Thank you.
And I'm
so
happy
much,
to answer
Colleen.
questions.
Thank you so much, Colleen. Thank you for sharing more about your experience at Mercy, as well as information on vaccines and how we can reduce our symptoms and hopefully decrease the amount of sick days that we're at home. So we do have some questions prepared for you guys. Feel free, anyone could jump in and answer. So these are just some questions that we've come up with just so that we could gain, just a little bit more information about long haul COVID, as well as for our listeners, so that they could best support not just themselves, but their loved ones. So what are the most common long-term symptoms of COVID-19, of long haul COVID that you've seen?
I can take that. I mean, I think that one of the biggest is the fatigue and the brain fog. Those are probably the two most common things that we hear. That they're just exhausted and that they have trouble, thinking through. They don't think the same as they used to.
Okay, so you've seen more of a mental piece than a physical piece?
It's a mental piece, a physical piece. It's also, just an overall, your entire body sort of having body aches and,
What we have seen to add to what Kathleen is saying is significantly higher levels of stress, anxiety, and depression. They go together.
Got it. Okay. What type of research is being done in order to create a treatment plan for individuals who have long COVID?
Well, I think I spoke to that about with some of the with the antiviral and the vaccines. Now people have, they're starting to see some improvement with those two tools.
I have a question. Hello, and first, thank you all for all of this amazing information. I have a few questions actually for all of you. We talked a lot about brain fog and cognitive fluency and how that can be significantly impaired. Well, I understand there's no direct treatment for COVID. What can a person who is experiencing these symptoms, what can they do to overcome them? Is there any sort of therapy out there that could help? Any exercises they can do?
Well, I hearken their cognitive changes to a rheumatologic condition we take care of it with that is lupus. We see that cognitive decline happens in lupus very, very often. It's very hard to diagnose, but we actually we send patients a lot to occupational therapy, to rehab therapy, vocational rehab, centers. A lot of every organization has a vocational rehab person who can help you with. We do things like memory tests, things to write things down so you can remember. There's different activities and it's almost like physical therapy for your brain, and that is something that is available. And I think to access it, one of the next questions on here is, how do you get the diagnosis and where can you go for treatment? And the specialty clinics, I know that Mount Sinai has one of the biggest right now long COVID centers. And again, it's interdisciplinary, and they're doing a lot of that physical therapy for your brain type of things to actually help improve that. So it actually there are things you can do, and they're definitely out there.
I see.
So this is almost, I'm just going to say, it's like to diagnose, it's like you'd have to, it's an exclusion diagnosis. You have to rule out everything else. It's almost like, oh my gosh, I'm having a brain fog. What is that disease, Kathleen?
Fibromyalgia.
Yes,
Mhm,
that is a
right.
disease of exclusion.
It's
You
a
rule out
Right.
everything else, and then it's, okay, this is what it is.
See. So I have
It's
a family
hard. It's really
member
hard.
who has gone through all the testing, they've seen specialists, everything has been ruled out. The last doctor that they saw was like, well, we've ruled everything out. You've got long haul COVID, like, but there's no next steps, right? Like it's just like, it's ongoing research. So I just, and the family member that I have, really just every single possible side effect is experiencing that Dr. Rossi had addressed. So, any sort of guidance or advice on how they can have, just a better quality of life.
Well, I think, again, it goes to how we treat patients with other chronic conditions is listening to your body, reorganizing things so that maybe you do activities when you're feeling okay, but you give yourself time to rest, taking, doing small things instead of saying, I'm going to go out and have this, all day event, do a half a day, then come home and have rest and then have something after. I think, listening to your body and organizing yourself that you have your times, because having your social life, having the things you want to do is really important to your mental health. Some of the mental health issues are because you're lost of who you and whether you can do things. So we really go at it slowly. Do something for 2 hours instead of what you would normally do for 5. But at least you get the enjoyment, and then listen to your body and rest, and then, kind of circle back around. But I think, resting in between naps, things like that is something very commonly our patients will tell us help them a little bit, that they'll do something, then they take a nap, and then they're better, they feel better. The other thing is exercise, getting exercise, whether even with acute COVID, what we realized was no matter how sick they were, moving them was the most important thing. And, the last thing you want to do when you feel really sick is move. But we know that even with things like fibromyalgia, with, a lot of things, movement does help you. So sort of making sure you get that is really important.
And to facilitate and support all of what Kathleen said is that need for adequate family and social support. Something that it sounds easy, but it's so difficult to achieve and have an adequate level of. And that can go a far way in terms of our recovery.
Definitely. I mean, the isolation was unbearable initially here on campus. These students were in rooms alone. They could, it was just unbearable. And that really played in, into how they fared with their mental health. And hope that thankfully it's not like it was, but that's where we saw the huge change in these, vibrant students' personalities. And then 2 weeks later, they were a totally different person. So, the isolation played a huge part in all this.
I have another question. I'm sorry.
Go ahead.
Colleen, you mentioned how Paxlovid was like helping reduce some of the long COVID symptoms. Could somebody who, let's say, is not currently infected with COVID, but like they have had COVID, they have the long haul COVID, could they take this antiviral and still get the same benefits, or would somebody need to be infected in order to actually have the benefits?
I think that's still being looked at, truthfully. I'm not going to prescribe someone Paxlovid at this point. That's probably what they're looking at in the research, to be honest. But no, I mean, to be honest, right now, in order to take Paxlovid, there's some pretty stringent guidelines to be prescribing this. I can't just give it to everybody. So, you need to be high risk, have some comorbidities. So
not to mention, Colleen, it's contraindicated with many common medications, right? Commonly used medications.
Yes, you have to stop statins, you have to stop certain medications before you can take this medication. So no, it is not a medicine you would just give to someone to see if it would help. Maybe they could find the research that's doing it and they could become a subject.
Yeah. No, my family member I keep referencing, is absolutely open to doing that. So we'll make sure that
the VA. It was the VA. We'll find that for you, Sarah.
Thanks.
So it seems like, during our discussion, thanks, Sarah, during our discussion, she was able to ask a lot of the questions that we either have here, or you guys were able to answer it. I do have one more out of the list that we have here, and this might be a little bit more on the Kathy side, but can you talk to us a little bit about the kids that you've seen come into the hospital? Are they experiencing long haul COVID? Do you see many kids coming in and experiencing brain fog or experiencing any of the, the physical things, the physical health conditions?
So I think it's much harder in children to identify and diagnose, because there's a lot of things that can impact children, just stress, anxiety, all of that. We luckily, in the beginning, we didn't have a lot of children with COVID, and now it's kind of changed. We definitely have some adolescents that we see some long-term COVID and again, it's a little hard to fetter out. Is it more because of, like Colleen was saying, the isolation, or is it because of the stress that's going on? But we do, at Montefiore, we actually do have a research study that's going on to look at, is this long-term COVID in children, and what the impact is and what will happen later. So I think it's definitely a newer area, and but we definitely did see some kids with severe COVID, and I think it probably will be a true diagnosis, but we don't have it as I don't want to say like a billable diagnosis as of yet for kids.
And at this stage, the recent epidemiological research tends to point out like fatigue and mood swings as the two most prevalent symptoms or complaints from children. And you're right, it's a very early stage research.
Right. And with mood swings, it's a teenager, right? So is that being a teenager, or is that, so I think that's where we have, the challenge.
Yes.
Right. And I believe it's hard to differentiate, long haul COVID with like other health conditions, you know what I mean? Just like, as you said, with kids, it could be anywhere from, them being a teenager to them actually having long haul COVID. But, I think of, people like, even for example, me, I've had COVID like 2 or 3 times, and, I've seen some, conditions that have come up, after having it 2 or 3 times, so I definitely think that it's hard to kind of differentiate, is this long haul COVID, or do I have anxiety, or do I have depression, or, am I just not getting enough sleep? You know what I mean? Or do I have mood swings? So, it's hard sometimes to differentiate, is this long haul COVID? Is this because I've had COVID so many times, or is this from something that, is much bigger?
Yeah, and I think one of the things that's very hard with long COVID is that most of the symptoms are not visible, right? So somebody feeling tired, that's not something you can look at them and say they have a rash. So it's this invisibility that then makes people think maybe I'm making it up, or people think I'm faking, or you look, when patients, people will say to them, you look fine to me. So that's very hard, because that can make patients question themselves and turn more into themselves and not want to talk about it. And it can, that it's a bad cycle. And that's where I think a lot of the additional mental health issues can come in.
Right. Well, thank you so much for that. Does anyone else have any other questions for our guest speakers?
I have one more question. So let's, we talked a bit about like disability benefits, right? But if there's no official diagnosis for long haul COVID, how would, and like it's significantly impacting someone's life where they can't work and they can't function, how would one even go about getting resources like that?
It's hard. I mean, I'm going to go back to fibromyalgia. That was, now it is a recognizable disorder, but it was another one of these diseases that people thought you were crazy if, that it was really not a definitive diagnosis, and took a long time, because it is, there are real symptoms associated with fibromyalgia, and it affects people in the same way. They can't work, they can't function. So I think I don't know, it's going to be a while, Sarah, probably.
Okay.
Yeah, I think Sarah brings up a great point, and me and her, we kind of, it seems like we were thinking about the same thing at the same time, like I was thinking about like our students, how we could best support our students who come into our office and they're experiencing long haul COVID symptoms. And because it's not an official diagnosis, we want to be able to provide them with resources for success, but it's hard, because it's not an official diagnosis. It's not something that we've had experience with that we could say, okay, we're going to give them these accommodations or take it on a case by case basis, which is probably what we would have to do. But, I'm kind of on the same page as Sarah here. How do we provide resources if we don't know exactly what it is or what's going on? So she definitely hit the nail on the head with that one. I want to know how to best support my students who have these conditions. So,
And Christina, I think there are some guidelines for deeming it a disability under the ADA. So
okay,
yes, there are some guidelines that have been put forward on that. So
okay. Thank you for that. Thank you.
Most important thing though is for disability to get it, is that the providers have to be on board with filling it out and being specific. And I think that's where, even with fibromyalgia, we have to be very specific, because if we do not fight for our patients, they will not get those services. So I think it's important to work closely with whoever your primary provider is, and again, an interdisciplinary team to actually help with that.
Right. Well, thank you guys so much for agreeing to be our speakers for today. We learned so much about long haul COVID, not just the physical side, but the mental piece as well. So we just want to thank you guys so much for stopping by and sharing this information with our students. So guys, just a little bit about our resources here at Mercy College. We have the Office of Health and Wellness. Our director is Colleen Powers. She acts as basically as an urgent care. If you ever need any services, feel free to drop by our office. That's Main Hall, room 127. We also have services in the Bronx, and services is coming to Manhattan soon. We have our accessibility office. We have 9 to 5, Dobbs Ferry, room 121. I am located in the Bronx primarily. I'll be there usually Tuesdays, Wednesdays, and Fridays. I'm usually in Manhattan on Thursdays. So if anyone ever needs any accessibility services, feel free to stop by, or you can email us or call us. We do have counseling services here at the Dobbs Ferry campus, room 123. And we also have Better Minds here for students, just in case, they're looking for virtual counseling. So we just want to thank everyone again for finding it not robbery to come and join our discussion today and learn